So we studied self-harm, and self-harm is when individuals hurt themselves on purpose. It's also called intentional injury. So it might include things like burning oneself, cutting one's arms, bashing one's head due to frustration into a wall or something like that. It can be associated with somebody having other mental health disorders. It usually indicates that the person is having difficulties coping, or they are truly trying to intentionally injure themselves and potentially commit suicide. It's very important to study young drivers and self-harm because it's actually a problem that affects many youth. Motor vehicle injuries have high impact in youth particularly, and particularly in young novice drivers. As well, self-harm affects up to 17% of the population of older adolescents and young adults, depending on what area you study. So 17% of the population engaging in self-harm, and then these individuals are also at higher risk of motor vehicle crash, which is already something that's highly prevalent in our community and has a large impact both economically and also socially on our communities. To study this issue, we were interested in how self-harm might be a risk factor for motor vehicle crashes. It's been hypothesized in the past that self-harm could be a risk factor for motor vehicle crashes, or that people who are attempting to commit suicide or injure themselves might do so using a vehicle. There have been some studies of this in the past, but most of them have been small studies. A lot of them have been retrospective, which means that people have had a crash and then they've been asked afterwards whether they were trying to engage in self-harm. And of course, this is particularly difficult if the person was to die during the motor vehicle crash. It's very difficult to know whether they were intentionally trying to injure themselves. So we were interested in looking at this relationship further. So what we did is we did a prospective cohort study, which means we gathered information on just over 20,000 adolescents and young adults when they first got their motor vehicle license. And we asked them to self-report on all sorts of variables that potentially are associated with risk for crashing, and including self-harm. So they were asked, in the past year, have you ever intentionally tried to harm yourself or hurt yourself? And if so, what was it that you did? Then what we did is we waited and followed them for 2 years, and we linked that data to routinely collected data by the Roads and Traffic Authority. And what we were then able to do is to look very rigorously at whether people who engaged in self-harm were at true increased risk of motor vehicle crash, which they are. In order to address this issue and to think about who might be engaged, what we do know about self-harm and youth and young adults is that very few people actually reach out or tell anyone that they're engaging in self-harm. One study showed that out of 40 people who engage in self-harm, only one person will actually tell anyone. So I think the first thing is to be aware, to open ourselves to the idea that people may be engaging in self-harm and we're not aware of it. So that would include people like general practitioners, psychologists, psychiatrists, teachers, families, and friends. And then the other thing that is important for us to be aware of, and that this study teaches us, is that self-harm is a unique and independent risk factor for crash, over and above other risk factors like psychological distress or sleep deprivation, drugs and alcohol. That self-harm in itself is a risk factor for crash. So what we also need to do is to be aware of this when asking youth what risks they engage in, and to try to develop programs that will try to reduce the engagement in self-harm, and therefore hopefully reduce the risk of motor vehicle crash in the end as well. Parents and schools and teachers can also have a role to play in helping young people, adolescents and young adults who engage in self-harm. One, by perhaps educating the population about self-harm, where to reach help, and also to help identify youth who may be engaging in self-harm. Sometimes it's a parent, both visually, somebody may have intentional burns or cuts on their arm, or they may be trying to seek help and may tell their friends and so on. So anybody in a youth's environment, family, friends, teachers, practitioners, can one, notice the problem, and then also refer the person to the appropriate location for care, because there are effective treatments for self-harm as well as other mental health conditions. So So from here, we recognize that these findings are, one, very novel. Nobody's really looked rigorously at this association between self-harm and motor vehicle crash. And given we found a significant association, we plan to do something about it, because otherwise the problem will continue. We have engaged with stakeholders in the community, clinicians, community health providers for mental health, and we are working on developing programs which will be rigorously evaluated in the future. And we look forward to getting back to you on that.